Palliative care is care that meets you where you are when you're living with a serious illness. I think that's the core of palliative care, where it is actually very person-centered, and it addresses the suffering that one experiences as one has to live with a serious illness. If you think palliative care is about suffering is actually a societal issue. Really, the whole Singapore society must really understand that. As a whole society, we really need to think about how it is not just a healthcare issue, but actually how we all have to adopt what I call a whole of society approach when we look at this problem, which is very tied to aging as well, but not limited to aging, right? Because a lot of young people do have serious illness and they die from it. I'm also very conscious that suffering is actually multidimensional, and suffering is inevitable in serious illness, and we don't pretend that we are able to resolve it, but we would like to say that you're not alone in your suffering. I think that's very important part of palliative care. Every patient has multiple encounters with multiple healthcare professionals in our healthcare system. And so if we don't get everyone trained, at least in even recognizing distress or suffering and knowing how to respond in a very fundamental, basic ways, then we actually miss suffering. We miss opportunities to address it. So I think definitely yes, for sure. Every healthcare worker should be trained in the basics of it.